Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
A 78-year-old client is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. Which nursing intervention is priority? 1. Prepare to administer recombinant tissue plasminogen activator. 2. Discuss the precipitating factors that cause the symptoms. 3. Schedule for a STAT computed tomography scan of the head. 4. Notify the speech pathologist for an emergency consult. The correct answer is 3. Schedule for a STAT computed tomography scan of the head. A CT scan will determine if the client is having a stroke or has a brain tumor or another neurological disorder. If a CVA is diagnosed, the CT scan can determine if it is a hemorrhagic or ischemic accident and guide treatment. A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour.
Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Clients with stomatitis have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing. When preparing the teaching plan for the mother of a child with asthma, which of the following should the nurse include as signs to alert the mother that her child is having an asthma attack? 1. Secretion of thin, copious mucus. 2. Tight, productive cough. 3. Wheezing on expiration. 4. Temperature of 99.4 degrees Fahrenheit. The correct answer is 3. The child who is experiencing an asthma attack typically demonstrates wheezing on expiration initially. This results from air moving through narrowed airways secondary to bronchoconstriction. The child's expiratory phase is normally longer than the inspiratory phase. Expiration is passive as the diaphragm relaxes. During an asthma attack, secretions are thick and are not usually expelled until bronchioles are more relaxed. At the beginning of an asthma attack, the cough will be tight, but not productive. Fever is not always present unless there is an infection that may have triggered the attack. When teaching a client about self-care following placement of a new permanent pacemaker to the left upper chest, the nurse should include which information? Select all that apply. 1. Take and record daily pulse rate. 2. Avoid air travel because of airport security alarms. 3. Immobilize the affected arm for 4 to 6 weeks. 4. Avoid using a microwave oven. 5. Avoid lifting anything heavier than 3 pounds. The correct answers are 1 and 5. The nurse must teach the client how to take and record the pulse daily. The client should be instructed to avoid lifting the operative side arm above shoulder level for 1 week post-insertion. It takes up to 2 months for the incision site to heal and full range of motion to return. The client should avoid heavy lifting until approved by the physician. The pacemaker metal casing does not set off airport security alarms, so there are no travel restrictions. Prolonged immobilization is not required. Microwave ovens are safe to use and do not alter pacemaker function.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with thyrotoxicosis says to the nurse, "I am so irritable. I am having problems at work because I lose my temper very easily." Which of the following responses by the nurse would give the client the most accurate explanation of her behavior? 1. Your behavior is caused by temporary confusion brought on by your illness. 2. Your behavior is caused by the excess thyroid hormone in your system. 3. Your behavior is caused by your worrying about the seriousness of your illness. 4. Your behavior is caused by the stress of trying to manage a career and cope with illness. The correct answer is 2. Your behavior is caused by the excess thyroid hormone in your system. A typical sign of thyrotoxicosis is irritability caused by the high levels of circulating thyroid hormones in the body. This symptom decreases as the client responds to therapy. Thyrotoxicosis does not cause confusion. The client may be worried about her illness, and stress may influence her mood. However, irritability is a common symptom of thyrotoxicosis, and the client should be informed of that fact rather than blamed. An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? 1. Put the tablet under the tongue until it is absorbed. 2. Swallow the tablet with 120 milliliter of water. 3. Chew the tablet until it is dissolved. 4. Place the tablet between the cheek and gums until it disappears. The correct answer is 1. Put the tablet under the tongue until it is absorbed. The client is having symptoms of a myocardial infarction. The first action is to prevent platelet formation and block prostaglandin synthesis. The client should place the tablet under the tongue and wait until it is absorbed. Nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums. The telephone triage nurse in the prenatal clinic receives the following calls. Which telephone call would require immediate notification of the healthcare provider? 1. Patient reports leaking vaginal fluid at 34 weeks gestation. 2. Patient reports nausea and vomiting at 8 weeks gestation. 3. Patient reports pedal edema at 39 weeks gestation. 4. Patient reports vaginal itching at 20 weeks gestation. The correct answer is 1. Patient reports leaking vaginal fluid at 34 weeks gestation. Leaking vaginal fluid at 34 weeks gestation requires immediate attention because it could indicate premature rupture of membranes with the risk of premature birth. A nurse in a prenatal clinic can safely give telephone advice regarding nausea, vomiting, and pedal edema, which can be considered normal in pregnancy. The nurse would assess the complaint, give the patient evidence-based advice, and define the circumstances under which the patient should call back. Vaginal itching at 20 weeks gestation could indicate a yeast infection. Depending on clinic protocols, the nurse could, after phone assessment, safely recommend an over-the-counter medication or arrange an office visit for the patient.
The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 milliequivalents per liter. The nurse should 1. Administer the 5 p.m. dose of lithium. 2. Hold the 5 p.m. dose of lithium. 3. Give the client 8 ounces of water with the lithium. 4. Give the lithium after the client's supper. The correct answer is 2. Hold the 5 p.m. dose of lithium. Rationale: the nurse should hold the 5 p.m. dose of lithium because a level of 1.8 milliequivalents per liter can cause adverse reactions, including diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the primary healthcare provider, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client the lithium with 8 ounces of water, or giving it after supper would result in an increase of the lithium level. thus increasing the risk of lithium toxicity.
Which interventions decrease cardiac demands in an infant with congestive heart failure? Select all that apply. 1. Allow parents to hold and rock their child. 2. Feed only when the infant is crying. 3. Keep the child uncovered to promote low body temperature. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. 7. Organize nursing activities. The correct answers are 1. Allow parents to hold and rock their child. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. And 7. Organize nursing activities. Rocking by the parents will comfort the infant and decrease demands. Frequent position changes will decrease the risk for infection by avoiding immobility with its potential for skin breakdown. An infant sucking the fists could indicate hunger. Change bed linens only when necessary to avoid disturbing the child. Organize nursing activities to avoid disturbing the child. The infant would not be fed when crying because crying increases cardiac demands. The infant might choke if the nipple is placed in the mouth and the child inhales when trying to swallow. Keep the child normothermic to reduce metabolic demands. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which interventions should the nurse discuss with the client? Select all that apply. 1. Chew the tablets completely before swallowing. 2. Monitor the dialysis graft for bleeding. 3. Take an over-the-counter proton pump inhibitor. 4. Check the radial pulse prior to taking the medication. 5. Take the medication with or right after meals. The correct answers are 1. Chew the tablets completely before swallowing, and 5. Take the medication with or right after meals. Lanthanum carbonate, an electrolyte and water balancing agent, should not be swallowed. The medication must be chewed for absorption in the intestines. Lanthanum carbonate should be taken with or right after meals. Lanthanum carbonate may cause graft occlusion, not bleeding. Lanthanum carbonate does not increase gastric acid secretion. Therefore, the client would not need to take a proton pump inhibitor. Lanthanum carbonate may cause hypotension, and the blood pressure must be checked, not the pulse rate. The 85-year-old client diagnosed with a stroke is complaining of a severe headache. Which intervention should the nurse implement first? 1. Administer a non-narcotic analgesic. 2. Prepare for stat magnetic resonance imaging. 3. Start an intravenous infusion with D5W at 100 milliliters per hour. 4. Complete a neurological assessment. The correct answer is 4. Complete a neurological assessment. The nurse must complete a neurological assessment to help determine the cause of the headache before taking any further action. The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. The correct answer is 2. Charting it separately on the output record. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it.
The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3, 4, 2, and 1. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with a fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client, who is NPO, for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. A child with cystic fibrosis is receiving gentamicin. Which of the following nursing actions is most important? 1. Monitoring intake and output. 2. Obtaining daily weights. 3. Monitoring the client for indications of constipation. 4. Obtaining stool samples for hemical testing. The correct answer is 1. Monitoring intake and output is the most important nursing action when administering an aminoglycoside, such as gentamicin, because a decrease in output is an early sign of renal damage. Daily weight monitoring is not indicated when the client is receiving an aminoglycoside. Constipation and bleeding are not adverse effects of aminoglycosides.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
When developing a plan of care for a child with cystic fibrosis who is scheduled to receive postural drainage, the nurse should anticipate performing postural drainage at which of the following times? 1. After meals. 2. Before meals. 3. After rest periods. 4. Before inhalation treatments. The correct answer is 2. Postural drainage, which aids in mobilizing the thick, tenacious secretions commonly associated with CF, is usually performed before meals to avoid the possibility of vomiting or regurgitating food. Although the child with CF needs frequent rest periods, this is not an important factor in scheduling postural drainage. However, the nurse would not want to interrupt the child's rest period to perform the treatment. Inhalation treatments are usually given before postural drainage to help loosen secretions. When teaching the parents of an older infant with cystic fibrosis about the type of diet the child should consume, which of the following would be appropriate? 1. Low-protein diet. 2. High-fat diet. 3. Low-carbohydrate diet. 4. High-calorie diet. The correct answer is 4. CF affects the exocrine glands. Mucus is thick and tenacious, sticking to the walls of the pancreatic and bile ducts and eventually causing obstruction. Because of the difficulty with digestion and absorption, a high-calorie, high-protein, high-carbohydrate, moderate-fat diet is indicated. At a follow-up appointment after being hospitalized, an adolescent with a history of cystic fibrosis describes his stools to the nurse. Which of the following descriptions should the nurse interpret as indicative of continued problems with malabsorption? 1. Soft with little odor. 2. Large and foul-smelling. 3. Loose with bits of food. 4. Hard with streaks of blood. The correct answer is 2. In children with CF, poor digestion and absorption of foods, especially fats, results in frequent bowel movements that are bulky, large, and foul-smelling. The stools also contain abnormally large quantities of fat, which is called steatorrhea. An adolescent experiencing good control of the disease would describe soft stools with little odor. Stool described as loose with bits of food indicates diarrhea. Stool described as hard with streaks of blood may indicate constipation. When developing a recreational therapy plan of care for a 3-year-old child hospitalized with pneumonia and cystic fibrosis, which of the following toys would be appropriate? 1. 100-piece jigsaw puzzle. 2. Child's favorite doll. 3. Fuzzy stuffed animal. 4. Scissors, paper, and paste. The correct answer is 2. The child's favorite doll will be a good choice of toys. The doll provides support and is familiar to the child. Although a 3-year-old may enjoy puzzles, a 100-piece jigsaw puzzle is too complicated for an ill 3-year-old child. In view of the child's lung pathology, a fuzzy stuffed animal would not be advised because of its potential as a reservoir for dust and bacteria, possibly predisposing the child to additional respiratory problems. Scissors, paper, and paste are not appropriate for a 3-year-old unless the child is supervised closely. Which of the following, if described by the parents of a child with cystic fibrosis, indicates that the parents understand the underlying problem of the disease? 1. An abnormality in the body's mucus-secreting glands. 2. Formation of fibrous cysts in various body organs. 3. Failure of the pancreatic ducts to develop properly. 4. Reaction to the formation of antibodies against streptococcus. The correct answer is 1. CF is characterized by a dysfunction in the body's mucus-producing exocrine glands. The mucus secretions are thick and sticky rather than thin and slippery. The mucus obstructs the bronchi, bronchioles, and pancreatic ducts. Mucus plugs in the pancreatic ducts can prevent pancreatic digestive enzymes from reaching the small intestine, resulting in poor digestion and poor absorption of various food nutrients. Fibrous cysts do not form in various organs. Cystic fibrosis is an autosomal recessive inherited disorder and does not involve any reaction to formation of antibodies against streptococcus.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.